Welcome to Maastricht, the host of the 2013 EuroPD conference. Maastricht is the oldest Roman settlement in the Netherlands and is the capital city of the Dutch province of Limburg.
Hi, I'm Nick Topley, the President of EuroPD, and it's my pleasure to welcome you to the 11th EuroPD meeting that will be held in Maastricht in October. The theme of the programme this year is putting the patient in the driving seat. It's an important topic because of the recognition now that everything that we do starts and finishes with our patients. I hope you'll see that we'll be presenting lots of new and exciting data which will impact directly on patient outcomes and survival.
When we started EuroPD in 1994, there was no other major PD-related meeting in Europe. The only major meeting was the ISPD, but it just came to Europe every couple of years. So we thought that to promote peritoneal dialysis, to get more people interested, we would like to set up a meeting to actually get all the people together that are interested in the field and present the actual science and also do medical education in that area.
The conference this year is focused on putting patients in the driving seat, and we've got a number of sessions to really address that issue. For example, having a session particularly around helping patients make good decisions about their therapy. So we're talking about patient decision aids and how we can support that and improve their quality of life.
The EuroPD program of this year is centered around two building blocks that are quite essential for what EuroPD stands for. Meaning, first of all, that we place the patient in the center of the scene, that we want them to be the focus of what we are doing. And as a consequence of that, secondly, we want to focus on those topics that are specific and different from what you normally would do in patients that come to in-center dialysis.
It's important for doctors to attend EuroPD for several reasons. The first is the main theme of the conference, which is home-based dialysis therapies. And I think personalized dialysis treatments, which is actually what home-based treatments will be very important and increasingly important for the future. Another thing is that there's a very strong connection between, on one hand, basic science and the other hand, clinical science. And what I like about the program of the conference is that you have a very good connection between the two. So you really understand from a basic science point of view what you're doing or should do as a doctor.
One of the sessions that I'm particularly looking forward to this year is a session where we're going to discuss some basic understandings of how the membrane, peritoneal membrane functions and is affected by time on treatment. So this session is going to be like a couple of debates where we look at the fundamental mechanisms of fibrosis, scarring of the membrane, and also how we describe the membrane in terms of modelling of the membrane. We're going to hear some different approaches to the way we might think about those problems. I'm very looking forward to hearing how that might change my view of how the membrane works. It's important for patients to make good decisions about their health care, because as you might expect, if they make good decisions, then they have better outcomes. Particularly, for example, they may be more satisfied with their health care, and they may, in the long run, have actually even better patient survival.
So we know that many aspects of basic sciences are very difficult to grasp for general audience, and this is where EuroPD steps in, and we try to make it as available as possible for all our colleagues in PD community.
German nephrologists should come to EuroPD because this is a unique chance of having hands-on learning. This is a unique chance of having the authorities tell you what to do in case of complications. I think most units have some experience with PD and how to handle patients. But once it comes to more sophisticated questions and difficult questions, this is your chance to learn it.
Nephrologists who do have a heart for their patient and who also really believe that the patient should be in the center of their activities should come to EuroPD, because we want to provide them with a package with the kind of information and essential key elements that we need to keep those patients at home, to treat these patients at home, and to try to adapt the treatment to the patient and not the patient to the treatment.
Thank you for watching. We look forward to seeing you all at the EuroPD conference in October.